Okay. So in this video, we're going to do a couple palpations, range of motion measurements, and strength tests on various forearm and elbow structures. So first, we're going to start off with our manual muscle tests because I already have my patient laying in prone. I'm going to start off with elbow extension. So can I have you bring your straighten your arm out as far as you can? Good. Okay. Perfect. I want you to kind of hold it in this range right here. Go ahead and hold this. Perfect. Okay. I'm gonna stabilize proximally with my hand up near her shoulder. I'm gonna go ahead and I'm gonna apply some pressure here. I want you to hold this position and don't let me move you. Okay. Ready? Okay. Ready? Hold. 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 Good. So I'll give her a 5. She held up to my max resistance. So great. Now we're gonna have her do forearm pronation strength. So I'm gonna have her sit on the edge of the table here. And we'll do her left one because it's closer to the camera. So right here, I'm gonna have you. Oh, I just want to see you bring your. I want to see you bring your wrist or bring your palm of your hand, kind of rotate it and push it downward. Good. So she has full range there. You can see it one more time. So she has full range there. Okay. Mm-hmm. So now I'm going to have you hold it in this position here. I'm going to stabilize proximally. Can you bring this a little closer to your... There you go. I'm going to stabilize proximally here. And I'm going to align my thumb and my thenar eminence up with her radius. I find it easier to kind of just almost envelop it with my thumb so she pushes into the more meaty part of my hand. And I want you to go in and I want you to bring your wrist like you're trying to bring it down. Like you're trying to bring your wrist facing your palm down. Okay? Mm-hmm. Ready? Mm-hmm. Go ahead. Good. So she's not really moving it, so good. Awesome. How's that? All right?
Mm-hmm.
Okay.
No, it's good. Nope.
Perfect. Okay. Now we're going to go into range of motion. So let me get you to spin. I guess I'll grab that chair over there. Can you just come on this side? No. Mm-hmm. Okay. Perfect. That's good. All right. So now we're going to do range of motion of forearm supination. So I'm going to grab my very small goniometer here. I'm not sure if you can really see. They can see okay?
I'm seeing good.
Okay. Good. So kind of opposite of what we did with pronation, which is we brought our palm facing towards the table. We're gonna or down towards the floor. We're gonna bring it like you're trying to hold up a pizza box. Okay. So perfect. So you can actually go into full, almost full range of supination, which is great. So I'm just gonna go ahead and throw a goni up here. That's perfect. I'm going to palpate for the distal radius and distal ulna. I'm gonna line up my movable arm with that. My immovable arm is going to be in line with her humerus. It's kind of tricky here, but that looks pretty good. Now, is there any more you can bring it? Is that good? Okay. And that looks pretty good right there. So I got 86 degrees of supination for her range of motion. And then we're also going to do elbow flexion. So I'm going to grab my large goni. Let me get a towel. Do we have a towel? Didn't we have a towel here? Oh, here it is. Here we go. So I'm going to have you kind of lay your arm, almost like you're trying to get into an arm wrestling position, on the towel. Perfect. Go ahead and bring your palm facing your face. Perfect. Let's see if I can get this up here a little bit. Good. Awesome. Can you bring the camera over here a little bit so you can get the outside here?
Yeah.
Okay, good. So I'm gonna palpate for the lateral epicondyle of the humerus, which is gonna be right here where my thumb is. Okay. Not sure if you can see it, but that's where my axis is gonna go. Okay. I go right there. I'm gonna line up my immovable arm with her humerus, and the immovable arm is going to be lined up with her radius. Okay. So go ahead. Can you just bring your try to bend your elbow as much as you can? Bring it up towards your face right now. Good. So active looks good. Hold it right there. And I'm actually just going to follow this Not back for that condyle again. I lost it. There it is. Okay. Good. Line up with that humerus. Apply a little bit of overpressure here. Line up with this radius. Good. And I got 156 degrees of elbow flexion, that's very functional. It's really good. Okay. Now let's go to palpation. So we got medial and lateral epicondyles of the humerus. Actually, I think that was 156. I think it was 146. I think that was 146. I think I read it wrong. But either way, it's normal range of motion. I think that was 146, though, degrees of elbow flexion. Okay, so in this video, we're going to do a quick palpation. So lateral epicondyle is a very easy, prominent bony structure here. So I actually like to find the olecranon first, which is that bottom part of the elbow. Move slightly lateral to find another protrusion here, which is the lateral epicondyle of the humerus. And then we're going to slightly go medial here. Scooch you around here. And again, I'm going to find that olecranon, big, easy, bony structure. Going to move slightly medial until I find that other bony protrusion, which is the medial epicondyle. Okay, good. Now bring us back down here. And last thing we're going to palpate really quick is the triceps attachment, or triceps insertion. So I'm going to find that olecranon, again, that big bony protrusion at the bottom of the elbow. And I'm going to go ahead and move my finger slightly proximal. And I think I'm on it, but just to confirm it, I'm going to have her do a quick isometric contraction, push into my hand here. Good. And then I can kind of feel that tendon pop into my hand. So relax again. Now do it one more time. Isometric, boom, pops right into my hand. Good. You can relax. That's it.